What's going on, everyone? It's Alex here from Alex Physio. So today I'm going to be going over 5 exercises that you can do if you have tib post tendinopathy. Welcome. For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia, and today I'm going to be going over 5 exercises that you can do if you have tibialis posterior tendinopathy. Tibialis posterior muscle is located deep in your lower leg. It runs down the back of your leg and loops around under the bottom of your foot and attaches on the inside of your foot. Its primary role is to invert the ankle and also plantar flex or point the ankle downwards, and it plays a really important role in stabilizing the inner arch or your medial longitudinal arch of your foot. In fact, individuals who have tibialis posterior tendinopathy, in severe cases, they can actually get an acquired flat foot, because if that muscle is not doing its job, then that can result in that arch collapsing, so you can get flat foot. It's important, especially in runners. So when you're running, when you're taking that step, it needs to work, that muscle needs to work eccentrically to control the landing of your foot. And if it's not optimally doing its job, then sometimes individuals can have a foot slap, or you can't control that landing of your foot, so the front of your foot is smacking the ground on each step. And again, over time, this can lead to some irritation and injury in the tendon, and something that, if left untreated, can progress into more pain, more dysfunction. So let's get right into it. The first exercise is going to be an isometric for your ankles, isometric inversion. So what this is going to look like, I'm going to stand with, if your right foot is affected, you're going to try and apply pressure into your hand in a position of plantar flexion, so where your toe is pointing down, just to try to bias your tibialis posterior tendon a little bit more. So I'm pushing into my hand, my ankle is trying to go up towards me, I'm applying pressure in the opposite direction with my hand, and I'm meeting that resistance, and I'm just trying to hold it. I'm going to try to hold for 10 to 15 seconds. The nice thing about the isometrics is that you can control how much tension you're putting based on how much counter pressure you're applying with your opposite hand. Okay, so we're going to try that for 15 seconds. Okay, that's exercise 1. Exercise 2, we're going to use a lacrosse ball or a tennis ball, and we're going to put it in between our inner portion of our heel, and we're going to squeeze the tennis ball with the inside of our heel. And we're going to try and work on some calf raises in this position. So we're going to go up on our toes, squeeze the ball as we come up, and as we come down, we're going to try to go for 15 repetitions. The reason why we're trying to squeeze the ball as we're coming up is we're trying to bias the tib post a little bit more by putting our ankle in a little bit more inversion, versus if you were just doing it without using the ball. Exercise 2, so calf raises with a ball squeeze. Third exercise we're going to do is we're going to do a single leg calf raise, and again, just loading the tibialis posterior tendon and the single leg complex more so. So we're going to go up on our toes as high as you feel comfortable, and then come back down, up on the toes, and come back down. Okay, so just a single leg calf raise. Exercise 4, we're going to do a balance exercise, but also focusing on some arch support on the inside of our foot. So what this is going to look like is you're going to stand on your right leg, or whatever leg is affected, and we're trying to twist our torso to the left and to the right. And as we do that, as you can see, there's going to be a tendency for my foot to want to pronate, or the inside of my arch to want to collapse. So you're really trying to focus on activating the small muscles of your foot and your tibialis posterior muscle, working on your balance and twisting to your left and right, trying to keep that arch from collapsing. That's exercise 4, so single leg stance with torso twists. In exercise 5, we're just going to work on some heel walking, okay? So very simple, minimal equipment. You're just trying to go up on your heels and trying to lift your toes and your forefoot off the ground, okay? So again, this is going to work a little bit more now on our tibialis anterior muscle, which is the muscle at the front of our shins, which also plays a role in tibialis posterior health and rehab. We're not only just trying to focus on strengthening the tendon and the muscle, but also some of the muscles around in the lower aspect of our leg. Do you have tibialis posterior tendinopathy, or have you ever been diagnosed with it? Which exercises have you found that have worked for you and haven't worked for you? Let me know how your experience has been down below. If you find value in my videos, please consider subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. I have almost 500 videos on various physio, exercise, and medical related topics. Until then, we'll see you in the next video. Thanks for watching.